Good afternoon. Welcome to all. We've got a great bunch here. Thank you all for coming. On the way here, as this great body comes and joins us, and then do some introductions and we'll get started. Please have a seat. Thank you for attending. This is part of a very exciting announcement. We're thrilled to be here together, joined by Federal Secretary of HHS, Mike Leavitt, and I'm going to introduce the Secretary in just a minute. I do want to acknowledge a number of folks here from my administration. Let me just point out two of my cabinet secretaries, General Tabner, my Secretary of Health and Human Resources, and Anish Chopra, the Secretary of Technology. We're also really happy to be joined by Delegate Stan Nixon, member of the House of Delegates from the Richmond area, Chesterfield. Glad to have him here as well. We are here to talk about a very important issue and an exciting announcement for Virginia, an award by the federal government to 12 communities around the nation to be pioneers in electronic health records. Building and improving the health information technology infrastructure in our Commonwealth and in our country is critical to providing quality health care moving forward. Not only providing care, but also dealing with cost issues and just improving overall quality and delivery of health services. As the complexity of the health network continues to grow, healthcare providers have to be able to have access to the best information and leverage that information to make the best decisions with respect to patient safety and health outcomes. It is critical that Virginia healthcare providers have the best access possible to electronic health records and to this information so that they can make good decisions. And during my 2.5 years as governor, I had a great opportunity to go around and see some really innovative uses of electronic health records in all parts of the Commonwealth. If we improve the health information infrastructure, we have the potential both to improve the quality of patient care and control the costs that have been so challenging for our healthcare system. In February, Secretary Leavitt came to Richmond, and I will say this about the Secretary, he's no stranger to Richmond or Virginia. He now lives in Northern Virginia, has a son who just graduated from Yorktown High School, which is in Arlington, or Fairfax, is in Arlington. And he has also been a great ally of ours on a number of issues in whether it's pandemic flu preparation or working on electronic records or other issues. But he came to us in February to announce that CMS would have a demonstration focused on increasing the adoption of electronic health records in small physician groups, as well as promoting value exchanges between these physician groups. Some electronic health records are obviously done by the large systems, but since so much of care is provided across the state and country in small physician groups, that was the focus area of this particular CMS competition and grant proposal. Secretary Leavitt challenged us. He said, look guys, you're doing a lot of things well. Why don't you get in the hunt, put your best foot forward, and see if you can be one of the 12 states that will be a part of this demonstration. We created a steering committee. The committee was led by Mike Matthews of Virginia, and you'll hear from Mike in a few minutes to lead the effort. They worked very hard. The steering committee included many in this room: physicians, businesses, insurers, health IT professionals, public health advocates, legislators, and cabinet members. They did good work, and we are extremely excited to announce today that the work has been done, the analysis has been run, and Virginia is going to be one of the 12 pilot sites for this 5-year initiative. We think that this initiative is going to provide absolutely critical information that will help us improve the quality of care in Virginia, and hope we can learn from it in such a way that those lessons can be spread, as with the lessons from the other pilot sites. I'm thrilled to introduce and bring to the podium to talk about the promises that this grant can, the promise that it holds for our healthcare future, Secretary Leavitt. I consider Secretary Leavitt a friend. As many of you know, he's a 3-term governor of Utah before becoming Secretary of Health and Human Services. He has been a real good ally with us, and maybe a particularly good ally because, having been a governor, he has a complete understanding for making policy is one thing, implementing policy is something else. Governors are implementers, and Secretary Leavitt has a great sensitivity to that. I was sharing with him a minute ago that I was with about 10 governors earlier this week at an educational institute focusing on educational issues in North Carolina, sponsored by former Governor Kaine. I tend to have a fairly, I don't know, not cynical view, but I think a realistic view about the fact that politics is a little bit like the entertainment industry, and once you're out of it, you're kind of out of it. I don't really, think generally we get remembered long after we've done this, bluntly. But I will say Secretary Leavitt is remembered by governors and former governors with great fondness, as I was there and people were aware that I was going to be seeing him later this week. Both Democratic and Republican governors who had served with him in a variety of capacities were excited to hear that and have great respect for the job he's doing and great public service he's provided to Utah and to the nation. With that, Secretary Leavitt, we'll let him.
The governor says that I understand a lot about what's going on in states. Let me tell you one thing I do understand, and it's the governor's vision for health care. And I am in agreement with it. It is a vision that ultimately will allow consumers to have more information about the quality of the care that they receive, and to know something about the cost of it and the way it compares. It will be a consumer-friendly vision of health care where people can actually go online and ultimately communicate with their doctor by email if they choose to, or make an appointment over the internet. They won't have to walk into a doctor's office and fill out the medical clipboard every time. They won't have to pick up big brown envelopes with tests in it and deliver it to another doctor's office. They won't have to hunt all over the world to get an immunization record. It'll be right there. It'll not only reduce the cost, but it'll increase the quality, it'll eliminate medical mistakes, and frankly, it'll be a lot less hassle. It's a big vision, and we want to help. Today we're here, if that vision were a car, we're here to talk about the transmission. Because there is a very significant problem that we all share in being able to implement this vision. And it is that one particular segment of the medical sector, small to medium-sized practitioners, have not felt motivated to acquire electronic medical records for a very practical reason. They ask the question, why should we spend $40,000 and go through all of the difficulty of transitioning into that world and then have insurance companies and the consumer get all the benefit? So we have to find a solution to that. We've got to find a way to change the macroeconomics of healthcare to where everybody shares in the value. Well, as the governor said, we were convinced that there was a solution to that. We were convinced there's a way to do it. It probably won't happen in Washington alone. So we went out to communities, and we went to 40 communities. We did this differently than we would normally do it. We wanted to set up a demonstration that would help us learn how to share the value. Usually we would take a map and say, what about here and here and here, and let's do it there. Rather than use the map method, we got a map out all right. We picked out 40 different communities and went to them and said the following. We want to pick out 12 communities who can show us the way. And we're interested in not just the medical family being involved. We need the entire community. By community, it could be the entire state. It could be Richmond. It could be a group of counties. It could be 2 or 3 different states that come together. You define what it means. But we need more than the medical family. We need the governor and the legislature. We need the hospitals, the doctors, the insurance companies. We need employers. We need the consumers. We need everyone to come together to develop a strategy on how to solve this problem. If there's one reason that Virginia is today being presented as one of the successful communities, it would be the word collaboration. Because all of those entities have come together to develop a very thoughtful way to solve this problem. Now, when I approached the community and the governor about this, I told them, we're going to make 12 big flags. And I want to plant those flags somewhere in a community in America. And what will come with those big flags will be 100 little flags. And with 100 flags will come a very direct proposition. And here it is. Anyone who is in practice with one of these flags will be paid extra on their Medicare patients the first year if they will have an electronic medical record system. The second year, We'll pay them more if they will use that electronic medical record system to report certain quality measures that the medical family have developed. The third and the fourth and the fifth year, we want to pay more if they will actually deliver high quality as measured by the quality measures that are being reported on their electronic medical record system. So in the course of 5 years, they'll adopt systems, learn to report on it, and then get paid more for quality. Changing the macroeconomics of the system to reward quality. Getting people into the system with a system and learning how to report with it. That's what this is about. The proposition can be very helpful in a financial way to those 100 practices. The maximum amount under this that any one physician could receive would be $58,000. However, a small physician practice, which we expect most of these will be, will have the ability to have a maximum of $290,000. 100 practices, you can do the math. This is serious money. However, it may not be enough for a practice to do it just with that money. So we've gone beyond that. We ask, as part of this collaboration, the state might want to consider doing something similar to this in Medicaid. Private insurance companies might want to do something that will advantage themselves by getting these doctors into systems. Hospitals might want to do something, and what we will see from this collaboration is a community-wide effort. So today, as we plant the flag that we had so hoped to plant here in Virginia and hand out those 100 flags, we will be developing a very strong transmission for this vehicle of the governor's vision. And I'm delighted that we're able to do it. And I think we ought to hear something from Michael Matthews, who is a local physician and the CEO of Med Virginia. And he's going to tell us about how it will affect people here in Virginia.
Again, I'm Dr. Edward Glenn, a family practitioner with Village Medical Associates. We've already heard today the importance of the electronic health record in medicine. I'd like to address the quality improvements we can expect with the implementation of this technology. I'd like to focus on two key areas: the exchange of critical patient information and medication management. These two areas, if we see improvement, will affect every one of us in here, because at some time we will all be patients. However, first, I want to emphasize that the electronic health record is not merely the replacement of the paper chart. It is a much more robust tool than that. For the primary care clinician, the electronic health record will change the way we practice medicine more than any other tool in our lifetime. With the demonstration project that's been announced today, primary care physicians will be able to adopt this technology with the financial incentive that it brings, and we'll be able to bring these quality improvements to our community. The first improvement we can expect to see with the electronic health record is the exchange of this critical patient information. When one of our patients is seriously ill, is rushed to the emergency room, that staff needs patient information immediately. They need to know what was the patient on, what medications, what allergies, what's the past surgical history, what is the past medical history. Just getting that information together is a daunting task. But even doing it in an immediate time frame, it's almost impossible. With the electronic health record, it's going to be as simple as a click of a mouse. And that information will be brought to the staff so they can provide the care they need to the right patient immediately. Another critical area of improvement we can see with the implementation of this record concerns medication management. In this community, we can even save lives with this implementation. No longer will we have to rely on pharmacists deciphering physician handwriting or shorthand. With e-prescribing, electronic prescribing, we will submit digital prescriptions, and we'll avoid all the unintended consequences that we face today in the paper world. Clinicians with e-prescribing will have immediate feedback on the drugs that they are trying to prescribe. They'll be notified of any drug-to-drug interactions that will interfere with what the patient is already on. They'll be notified of any new drug warnings out for that particular drug. These warnings come out multiple times per week, and no clinician can expect to stay well-informed without electronic assistance. The future of medicine has changed with the tools technology has given us. And with this demonstration project, we can now expect clinicians from small to medium-sized practices to begin to adopt this technology to bring those quality improvements to our own community. So on behalf of the primary care clinicians and our staff, all of whom share the vocation as healers, we thank you for this opportunity.
Governor Kaine, Mr. Secretary, and distinguished guests, it is my honor and privilege to accept this award on behalf of the Commonwealth of Virginia. We are very proud of the collaboration that has come together to be able to participate in this very significant CMS EHR demonstration. Our team has worked very closely with the task force that was already referenced. But I would say we put the words on the paper, but indeed, those are just words. It's the commitment, the engagement of all the stakeholders in the community that really have made this proposal a success and will make the program a success as well. I'd like to share just a couple of statistics of the impact of the electronic health records to impact some of the areas of greatest need in our community. 20% of seniors have 5 or more chronic conditions. Those 20% average seeing during the course of a year 13 different physicians and receive 50 different prescriptions. And I often tell audiences such as this, imagine you're the 13th physician writing that 50th script. On a good day, having a few pill bottles in front of you from the patient. On a bad day, having to deliver the care without any clue what's been going on. The stakes are too high, the evidence is too great for us to maintain status quo. Now is the time to change. And we have the leadership in place. Mr. Secretary, I cannot thank you enough for the work that you've done at the federal level to improve the marketplace for the physicians who, as you said, are the ones who are making the expenditures for others to gain that benefit. We've seen fundamental change in this certification of electronic medical records, giving the physicians more confidence. We've seen standards developed to drive toward interoperability so systems can talk with one another. And Governor Kaine, we certainly appreciate the work of you, your administration, and the General Assembly in pushing forward the HIT agenda here in the Commonwealth as well. One of the things we did with the HIT Council funds, so generously provided by the Commonwealth, is to connect the free clinics in this community together so that they likewise will be able to reap the benefits of information technology investments, ensuring that no provider, no patient in this Commonwealth will be left behind. So we applaud the efforts. We're very proud to participate, and congratulations to all the members who have worked so hard in putting this proposal together. Thank you very much.
Plant a flag.
Very good. Thanks, Ron.
Well, let me thank everyone for coming. I'm going to open it up for questions in a second, but let me just offer one additional reflection. You know, innovation then drives further innovation. Dr. Glenn was talking about the ways you can use electronic health records to improve quality and making sure you're not misreading handwriting, or a patient comes into the emergency room and can't tell you what medications they're on, but the click of a mouse will tell you so you can get appropriate care. But the other thing electronic records does is it gives us the ability, a platform for more robust future innovation. If you link a lot of practice groups together and a new prescription comes out and the practice group prescribes it to 3 or 4 people and maybe one has an unusual reaction to it, Well, you could dig through the records to see that's an unusual reaction. Is there some challenge here, or was it just an odd aberration? But if you have electronic records, you have a research database where you can look across a lot of practice groups or hospitals and determine, okay, what's happening with others who are receiving this medication. You get the ability to have information about outcomes in a more instantaneous way that you can search and research, and then that will drive you forward to further innovation. So this is truly a patient care in here and now and kind of in real time, but an accelerator for additional improvements in patient care in a wonderful way. So for these practice groups that will be involved, and then the individual physicians, the ones who are involved are going to have some lucky patients, is what I got to say, some very lucky patients. And we hope that we're good partners, Mr. Secretary. We learn a lot, generate a lot of interesting information out of this grant, as the other localities and communities will, and then we'll use this to drive additional improvements in the state's and nation's healthcare delivery system. We thank you for your confidence in us.
Thank you.
And with that, I'll be glad to open it up and take questions, either for Secretary Leavitt or me, or some of the physicians and folks who worked with us. I'll be glad to take questions.
Security, anything about security? Any issues that...
Yeah, let's talk a little bit, maybe from the physician standpoint. The security of information is obviously, a huge issue when you're dealing with electronic records, whether it's our tax department with tax information or others. We put some legislation in place this year to protect against inadvertent disclosures of information. So whether it's a government agency or a business in Virginia, if information is disclosed even inadvertently in proper sources, people are entitled to proper notification. But let's talk about security on the physician practice side.
Certainly. I can speak from the level of the clinic, of my local clinic. When we implement the electronic health record, currently in the paper world, I never know which secretary has gone through whose chart. I would never know if my front desk said, oh, I know so-and-so's in the office. I'm going to go look at her chart. With the electronic health record, there are footprints with each individual who has looked at that chart. So I will always know, first, who's gone through the chart. But second, I can control what amount of information each person in the clinic has. Maybe they just have information to their address. Maybe if it's a nurse, they need more information. If it's a clinician, they will need all of it. But we can control it better with electronic health records than we will currently in paper state.
Thank you.
Other questions? Please.
I'm Al Starosky, the CMIO at VCU Health System. As a governor, you talk about implementation. How can we help those small physician practices to be able to help implement the electronic medical record system? In other words, how can we make sure this transmission is not a manual, it's an automatic?
Well, let me see that maybe some of my cabinet secretaries, Marilyn and Nisha, work on this, might have some thoughts too. I mean, clearly the financial incentive is very helpful, because I mean, a lot of small practices would like to do this, but are wrestling with how can they make it affordable. The insurance reimbursement is not going to cover it. The normal Medicaid reimbursement might not cover it. How do you make the investment? So obviously this will help many small practices who might not otherwise do it. And we've had state funds as well that we've put in place and have given grants from state monies to also encourage the same kind of adoption of these protocols by small or medium-sized practice groups. And Nisha, looks like you might want to take that.
A quick one, if I may, Governor. Dr. Erskine, we have, as part of the grant request that was awarded today, we explicitly said that should we win this award, we will build an approach that brings our providers and other communities together to come up with a business model innovation for how we deploy the electronic medical records to the clinics. So doctors can buy amongst any of the certified products that are available, but we're looking to go above and beyond just letting them buy what's available. We're looking to come up with a preferred tier that will have some benefits that will come from the experiences of those who've gone the path. VCU is one of the institutions in Virginia that's now nearly universal in its adoption of EMRs, and your expertise will be brought forward in this way. Thank you.
Other questions? Well, again, it's a very, very exciting occasion, and Secretary Leavitt is always welcome in Virginia, and we really appreciate his great service and confidence in us, and we'll make this work. Thanks so much.
Thank you.